So hi, um, welcome again to our third virtual event in the Policy Lab for Shared Prosperity Speaker Series, Breaking the Cycle of Chronic Scarcity. We have two wonderful speakers today who are going to talk about how limits on the resources that a person can have in order to receive benefits through safety net programs keeps people from being able to build real economic security. Our speakers today include Signa Mary McKernan and Tyler Wodrowski. Signa Mary is a vice president of the Center of Labor, Human Services, and Population, and co-director of the Wealth and Financial Wellbeing Initiative at the Urban Institute. She is a national wealth building and financial well-being expert with 2 decades of experience researching access to assets and credit and the impact of safety net programs. She co-edited the book Asset Building and Low-Income Families, co-authored a chapter in the Oxford Handbook of Economics of Poverty, and advised the Consumer Financial Protection Bureau in setting up its research unit. Tyler Wodrowski is a multifaceted research professional and policy advocate with experience in many different policy areas. He currently serves as management analyst intern at the Alexandria, Virginia Department of Community and Human Services, where he assists with the design and implementation of Alexandria Recurring Income for Success and Equity, an innovative guaranteed income pilot program. Tyler recently completed a master's degree in public and international affairs from Virginia Tech, where he focused his research interests on outcomes of recent federal environmental policy decisions in the Western United States. So before I turn the presentation over to our speakers, I do want to say a few words about the Ideas 42 Policy Lab and provide a brief introduction to our topic. So at the Policy Lab, we apply insights from behavioral science to advance public policies that promote equity and well-being for everyone, but with a focus on those policies that are most important for people experiencing poverty and Black, Brown, and Indigenous folks, people with disabilities, and people from communities who have faced historic discrimination. We are working towards a more just and equitable world, one where people have the resources they need, not just economic, but also the political and social capital to lead lives with dignity and autonomy. With the Policy for Shared Prosperity event series, we bring behavioral scientists and researchers and practitioners together to discuss the pressing policy issues of the day and how behavioral science can help us make better policy decisions. Today, we are going to be talking about resource limits, which are limits on how many resources a person can have in order to participate in safety net programs. Resource limits vary by program and by state. So for example, in Georgia, a family would have to have less than $1,000 in savings to apply for and be eligible for TANF. So that means people participating in public benefits programs often can't build the savings or resources they need. If you think about it, $1,000 is less than what you would need for 1 month's rent in almost any place I can think of. So you are going to hear from our speakers today about how these limits perpetuate inequality and make it harder for people to obtain financial security. And with that, I'm going to turn it over to our first speaker, Signa Mary McKernan.
Thank you, Kelly. It's a pleasure to be here today. And I find myself smiling with a funny look on my face because I'm loving the chat, all the different comfort foods. So just to turn to the topic at hand, you've lost your job and you need the safety net for support so that you can continue to put food on the table for your family or need that cash to pay your rent that Kelly just mentioned. Those with a privileged family history, will be able to turn to a private safety net, family members with wealth. Others will turn to the public safety net, our country's supplemental nutrition program, sometimes known as food stamps, cash assistance like TANF, and other emergency programs. And you hear, watch out for the resource limits. Best not to have a bank account or any savings in it. Like what? You close your bank account, you end up receiving the country's emergency COVID relief payment that you desperately need last, if at all, because you don't have a bank account. And you're in a poor position to weather future emergencies. So we can do better than that. It's an honor to be here today to talk about wealth and asset limits and public assistance programs. And if you're not familiar with the Urban Institute, we're a nonpartisan research institute with a staff of about over 500 working on focused solutions in economic and social policy research. So wealth inequality is growing. And wealth isn't just for the wealthy. It's insurance against tough times. It's tuition to get a better education and a better job. It's capital to build that small business or to buy your first home. It's savings to retire on, and it's also a springboard into the middle class. So wealth translates into opportunity. Wealth enables people to meet their full potential and to contribute more to the overall economy, which benefits Americans of all backgrounds. A strong, vibrant, and thriving middle class is important for economic growth. In 2019, the typical white family had 8 times the wealth of the typical Black family and 5 times the wealth of the typical Latinx family. And despite some fluctuations over the past 4 decades, this racial disparity was as high in 2019 as it was in 1983 for the typical Black family, and about half of that level for the typical Latinx family. Our country's current focus on racial justice and inclusive recovery provides the opportunity to change that trajectory. And some people assume that these wealth inequities stem from lack of personal effort to improve their financial situation. But historical research and analysis show that the origins of this wealth inequality lie in policies, programs, and institutional practices, which created barriers to building wealth for Black families, while creating pathways to building wealth for white families. Some of those barriers were violent attacks by white mobs on Black people, their homes, and their communities, such as during the Tulsa Race Massacre. Racial covenants that prevented Black families from buying white-owned homes are another. And then redlining that starved Black neighborhoods of investment. That's the third. So our country continues to cope with discrimination, and the low wealth resulting from it is passed from generation to generation. Urban Institute research finds that white families are about 5 times more likely than Black families to receive a large gift or inherit money. And when they do, they receive less. So these disparities contribute to the wealth gap. This is money that can be used to weather an emergency or to pay for major family investments, like attending college or a down payment on a home. These and other findings suggest that income alone will not solve wealth inequities. The racial wealth gap is 3 times larger than the racial income gap, and research has shown that this disparity cannot be explained by differences in education, income, or even savings rates. In fact, Black households headed by a person with a college degree have less than 70% of the wealth of households headed by a white person who did not finish college. Wealth-based, not just income-based solutions alone are going to be needed to close the wealth gap. So what are some of the contributors here? Today's skewed federal subsidies exacerbate the disparity in wealth holdings and the racial wealth gap. The federal government spends billions of dollars annually to support long-term asset building through the mortgage interest deduction and through preferential tax treatment of retirement savings. But because these go through the tax code, the subsidies primarily benefit high-income families who have substantial savings already, leaving out younger people, African Americans, and Latinx families who have lower income. Today, about 2/3 of homeownership tax subsidies and retirement subsidies go to high-income taxpayers, that top 20%, while low-income taxpayers, the bottom 20%, receive almost nothing. Solutions to this could include reforming or eliminating the mortgage interest deduction so that it benefits not just those at the high end of the income scale, like a first-time homebuyer's credit that would more equally benefit all homeowners and also be more effective. Other solutions are promoting retirement savings through a refundable savers credit and through automatic individual retirement accounts, such as some states like New York and Oregon are leading the way. In addition to receiving few incentives to save, those upside down asset building subsidies I just mentioned, families with lower incomes also receive disincentives to save. For example, families can hold $1,000 in Georgia and be eligible for TANF, as Kelly explained, or they can hold only $2,500 in liquid assets and be eligible for SNAP, the Supplemental Nutrition Assistance Program, or have food stamps in other states. So these asset limits, or I think another good word for them is these savings penalties in our safety net, have unintended consequences, and they create another systemic barrier to building wealth. Urban Institute evidence shows that relaxing SNAP asset limits increases participation in mainstream financial markets. People are 5% more likely to have a bank account, which would mean that they receive their federal stimulus payment more quickly. And it also, relaxing SNAP asset limits also increases households who do have some low income savings. They're 8% more likely to have at least $500 in liquid assets. We've seen some policy action on assets. 24 states and DC have eliminated SNAP asset limits altogether through broad-based categorical eligibility and other mechanisms. The state of Michigan, the governor announced relaxed safety net program asset limits, and then also made them consistent across multiple programs. And they cited Urban Institute's unintended consequences research evidence. So if you're an advocate, there's links in the slides. And what Michigan did in citing this evidence about these unintended consequences is they lifted and aligned their asset limits across their state food, cash, and emergency assistance programs. In their case, they lifted them to $15,000. And so what we did in this case is we took our more complicated research report where we did the deep research, and we summarized it in that aptly named unintended consequences of SNAP asset limits to make our findings more accessible to policymakers, and it worked. Policymakers often want and need evidence in order to make a difference. So just focusing on this slide a little bit longer here, why are we seeing effects only at the $500 level in a bank account and not at the $2,000 level? That was a question that we had as we were conducting the research, given that SNAP asset limits at that time might have been about $2,000. Now they're about $2,500. And so we thought, why is the effect so low? And the behavioral effects for this audience, and there's some behavioral science for experts to consider, because our findings are consistent with research that finds that people don't understand program eligibility rules. They're complex and they differ across programs. Thank you, Michigan, for making them more consistent. And so, like I said at the opening, what people know is, oh, you better not have a bank account and you better not have any money in it. So people unnecessarily keep their asset limits at very low levels to ensure eligibility. And in qualitative interviews with TANF, cash assistance recipients, for example, Rourke O'Brien found that most recipients believe that TANF asset limits were much lower than the actual asset limits. So why are asset limits important? We talked about the disincentives, those disincentives to save, and they matter. That lack of a bank account means you can't get that direct deposit for that government relief check. But in other research, we found that even a small amount of emergency savings can help families be resilient to economic shocks. Families with a non-retirement savings cushion of as little as $250 to $749 are less likely to be evicted and to miss a housing or utility payment after they lose their job, have an unexpected health emergency, or a large drop in their income. And we know that income can be very volatile for many. We found that higher savings levels, above that $750 amount, were associated with even lower hardship when one of these adverse events happen. We also saw that savings are at least as important as income. Low-income families with savings of $2,000 to $4,999 are more financially resilient than middle-income families living without saving, just living paycheck to paycheck. Okay, so why else do these asset limits matter? We've talked about emergency savings, but they also are affecting other programs out there. So there's a body of research that suggests that the Assets for Independence program, this was a national match savings program, that in the legislation for that program, they carefully wrote in that savings and individual development accounts could not count against asset limits for determining means-tested program eligibility. So they said that these cannot count in those asset limits. You cannot be excluded from means-tested programs just because you have saved in our program, which is trying to support lower income families and savings. And that was thought to be in the literature one of the main reasons for some of the random control trial evaluation effects that we were finding is, increased participant saving. We found that suggestive evidence that the program increased home ownership among renters and increased business ownership among non-business owners. And then also that families had fewer hardships, like the number of times that they couldn't pay for their housing, their utility, or their needed medical care and improve financial well-being. So asset limits are important, and it's that they're waived so that other programs like match savings programs can work effectively. And then just turning next to another program that you might be hearing a lot about right now, and that is baby bonds or baby trusts. This is a bold solution to close the racial wealth gap. To address this wealth disparity, scholars, none more prominently than Professor Derek Hamilton, and policymakers have proposed baby bonds or baby trusts, which are an economic birthright to capital that children and babies born would get them depending on their family's wealth, and then by the time they turned 18, they could use them for wealth building, such as buying a home, that's supporting a small business or education. Professor Zood simulated how a universal baby bonds program would narrow wealth inequities by over 90% while improving the net asset position of young adults. And children's savings accounts, which are a predecessor to baby bonds, have been proposed in Congress. So baby bonds right now are ripe for piloting and evaluation. Connecticut was the first state to pass baby bonds legislation. DC also passed. California passed another version, and we've created a learning community to support states as they're thinking. And one of the first things we warn about is, and we didn't even have to warn California, they asked about it, is concerns about participants losing eligibility for Medicaid and other programs because of asset limits. So once again, asset limits are affecting other programs too. So I'll just pause there and can answer more questions in the Q&A. Thank you.
Hi, everyone. My name is Tyler Wodrowski. I'm currently a management analyst intern at the Alexandria Department of Community and Human Services, and I'm happy to be with you here all today. And I've had the pleasure of working on and helping design and implement Alexandria Recurring Income for Success and Equity, an innovative guaranteed income pilot over the past year. And before I begin my remarks, I'd just like to thank colleagues at Ideas 42 for many hours of support that provided us over the last year. Ideas 42 has been crucial in supporting the ARISE design and implementation team with behavioral design recommendations, targeted advice on how to frame our guaranteed income pilot to the public, and nuanced analytical feedback on program logistical issues, such as supporting guidance for a hold harmless fund for our ARISE participants. Thank you for your support, Ideas 42. Next slide, please. And before I begin, let's go over a brief agenda. I'm going to discuss how asset limits harm people in practice, and then provide some brief policy recommendations on how to get ahead of this problem. And at the end, we'll take questions. Next slide, please. Okay, harm number one. As Signe Mary alluded to in her previous remarks, as you know, public benefit program recipients are forced to compromise in the face of a perverse and counterintuitive incentive structure that demands recipients to either pare down their monthly savings or risk having their benefits cut due to exceeding specific asset limits. And I want to preface this remarks by saying that I'm not a benefits case manager or a benefits counselor, but I would like all of us as participants in this webinar to think of yourself as a benefits case manager and having to divulge guidance on benefit programs and presenting that contradiction to someone who is experiencing extremely challenging socioeconomic and social and health circumstances. That is a horrendous choice that I've never had to take, nor has anyone in my family, but I can only imagine how exceedingly painful it is. And I'll get to remarks on how to potentially change the system so that less people have to go through that. Harm number two, rules and policies are not written so that beneficiaries of public assistance programs, such as vulnerable individuals and families, can read them and make informed decisions. And one specific case study example of this is the previous administration's public charge rule. As many as you probably know, it was written for specific categories of green card and visa holders. And there was a significant amount of disinformation propaganda that was behind the promulgation of the rule. And that in turn created significant fear and confusion amongst vulnerable families. So much so that in the city of Alexandria, not only did they obviously did not want to participate in programs related to the public charge rule, it dissuaded them from wanting to participate in other programs that they were legally entitled to, such as SNAP and TANF, because of the fear that that rule created in terms of immigration policy. And moreover, people do not know who to trust in terms of public agencies broadcasting of program information. There's a lack of human-centered design in these processes, and there's a lack of trauma-informed considerations in benefit program design and rental assistance. For example, I participate in volunteer anti-eviction efforts in the city of Alexandria, and last week I had the opportunity to go to the Alexandria courthouse and sit in on some eviction proceedings at the courthouse. And I can't even tell you how heartbreaking it was to witness this, and how heartbreaking, how unfortunate that our institutions cannot convey the system in a way that at least meets the immediate kind of lived and material and social circumstances of people who are grappling with a diverse set of crises, such as potential eviction, lack of employment, substance abuse. And seeing this up close was heartbreaking. And I think that goes back to the notion of trying to implement and promulgate more human-centered design in not only public benefits programs, but other administrative processes in general that affect a large swath of the population. And in addition to that, I would like to dive into another harm of asset limits, how that affects people in practice. And I'm going to present this in terms of, in the context of building and designing a guaranteed income pilot program. insofar as is that there is a lack of bureaucratic inertia and lack of interagency coordination. So for example, my colleagues and I at the City of Alexandria have been trying to accrue benefits waivers for prospective guaranteed income pilot participants so that they can, one, not hit the benefits cliff and lose their traditional benefit program assistance, such as Section 8, housing waivers, SNAP, TANF, etc. So they can keep the benefits and count their guaranteed income pilot payments not as cash, but as a gift, so they can avoid federal taxation. And going to give a specific example here. My colleagues and I met with representatives of the U.S. Department of Housing and Urban Development to start a conversation to implement or begin the process of waiving income eligibility guidelines for housing assisted beneficiaries concurrently enrolled in guaranteed income pilot programs. And the meeting was startling. It was frustrating because the individuals that we were interfacing with had no idea even how to go about to create an eligibility waiver for potential guaranteed income pilot enrollees. So I think that adds to the argument that there is a lack of interagency coordination, and there's a preponderance of bureaucratic inertia that is really hard to work against and to work through, and that at the end of the day, that's only going to come at the disservice of public benefit program recipients and beneficiaries. And it keeps the current system in place. Next slide, please. So one specific policy recommendation is guaranteed income. And broadly speaking, it is a floor and not a ceiling. It provides a minimum economic payment that will incentivize individuals and families to make decisions that are in their best interest, and to not only meet their immediate material needs, but to start saving for to down payment for a house and to accrue assets, wealth building, home building, etc. And one of the fundamental principles of guaranteed income is that there are no strings attached. So once you're enrolled in a guaranteed income pilot, recipients face no restrictions on assets, income, or in addition, how they even spend their monthly benefit. So once you have the payment in hand, you are able to use it as you see fit. And furthermore, I'm going to discuss some information about my program, Alexandria Recurring Income for Success and Equity. It is a $500 payment program for 24 months for 170 recipients. And there are specific eligibility requirements. So if to successfully be onboarded into the Guaranteed Income Pilot Program, you have to make at or below 50% of the area median income in the city of Alexandria. And the most recent figures from 2019, I believe, that is $49,000 per year for an individual or below, or approximately $71,000 per year or below for a household of 4. And in addition to onboarding 170 recipients for a guaranteed income pilot program, there's going to be a robust mixed method research component that's going to track health, social, financial, and mental health statuses and outcomes for our recipients throughout the duration of the pilot in conjunction with the research firm. And at the end of the day, guaranteed income meets near-term immediate economic needs while providing a platform for increased economic mobility, increased savings, and wealth asset accumulation. And specific to guaranteed income, there are more policy recommendations that jurisdictions, federal government, working in conjunction with nonprofit partners should consider, such as a benefits waiver. So for example, if you were enrolled in both a traditional public benefit program, such as SNAP, TANF, et cetera, and a guaranteed income pilot program, jurisdictions such as the city of Alexandria have been working to provide benefits waivers so that recipients can count their guaranteed income payments as a gift and not cash, thus avoiding federal taxation. And in addition, the benefits waiver will go a long way to ensure that they can still keep the traditional benefit and not exceed the asset limits or the income eligibility requirements of these other benefit programs. And for example, specifically, my colleagues and I accrued procedural authority from the Virginia Department of Social Services for ARISE recipients to count their monthly payments as exempt unearned income for purposes of determining eligibility for certain programs. So we received procedural authority for temporary assistance for needy families, for the low income home energy assistance program, or LIHEAP, child care subsidy program, child support, and unemployment insurance. So if you are enrolled in our guaranteed income pilot program, you will be able to, one, not count the monies behind that as cash. It will be counted as a gift, and you'll be able to keep those other benefit programs and still be able to successfully participate and enroll in those programs. Unfortunately, we were not able to receive procedural authority for the SNAP program, for Medicare or Social Security, or for, like I said earlier, housing. And another specific policy recommendation would be a hold harmless fund. So for jurisdictions grappling with concurrent guaranteed income pilot and benefit program enrollment issues, cities can dedicate a hold harmless fund to compensate GIP enrollees for potential loss in benefits, so whose overall income may be reduced because of the cash payments, and how that may affect their eligibility for public benefits. And this last policy recommendation that I personally have, I think it's bordering on more of the conjecture and the idealistic, but I think it's incumbent upon jurisdictions, the federal government, nonprofit partners, all entities and individuals that work in this broader space to imagine a system that can be and should be written by those of who are using the system, right? So it's consumed equitably and it's governed equitably on behalf and in the best material interests of public benefit program assistant participants. Jurisdictions could remove penalization of savings and home ownership. Signa Mary alluded to previously, remove savings and ownership restrictions for not only some, but all beneficiaries, and recenter individuals who are facing financial insecurity into the conversation so that they are in the best position to make decisions about themselves and their livelihoods. And guaranteed income is a great first step and a great first stab at doing that. And that concludes my remarks, and I would be happy to take any questions. And thank you.
Thank you all for your really great presentations. We have several questions that have come in the chat, but I do want to kick us off with, I'm going to take the prerogative of being the moderator to kick us off with one question, which is to both of you. So one is, could you talk a little bit more about the history of why asset limits have been built into some programs while asset building subsidies have been designed to benefit people with higher incomes? And related to that, I'd like to hear a little more about what it would really mean to have a system that is written by its own beneficiaries.
Yeah, I'll start with the first one, is about why our systems design this way. And I think for a long time in the United States, and I know Robert Moffat has written about it and others too, there's this idea of the deserving poor, who deserves support. And I think that, I hope that, and then you think about maybe with Ronald Reagan, this idea of this welfare queen, this image, which was, is very rare, but this powerful image that went into people's minds. And so the idea behind, say, asset limits or asset tests is to limit program and eligibility and benefits to those people who are most in need. So to channel program dollars to those with a weak financial safety net. Like, as we've discussed, they have unintended consequences. and the people who need them the most are the last to receive them. And then just why higher subsidies to higher income people? You know, when we have public programs, like let's say the Assets for Independence Act, which was a matched savings program targeted at people with lower incomes, it was required to have gold standard random control trial evidence about whether it works. But whether the subsidies that go through our tax code works, you know, like many of them, like the mortgage interest tax deduction has not been shown to increase home ownership, you know, more just debt. So it's much less transparent, it's held to less standards, but because it's written as a tax cut, even though it's reducing federal revenues, I don't think it's looked at the same way.
Yeah, I'll take a stab at answering the second portion of that question. To me, and I'm no expert on this subject by any means academically, but the history of the social safety net in the United States has been one of something that's been instituted and put into effect, implemented by those of whom that have the education, the means, and the experiences to do so, right? This is their specialty. This is designed by those of whom who do have expertise in these areas. And there's always going to be a space where programs are designed and implemented, but they're not communicated in an effective way to those of whom that don't have that experience. And to me, the question is, how do we overcome that gap, and how do we effectively just erase that gap and imagine something, as Signa Mary alluded to, something that's revolutionary or just new. And my colleagues and I at the City of Alexandria attempted, and I think have done this successfully, back in late 2021. We designed a survey to administer to 20 individuals in the city of Alexandria to ask broad and specific questions about their material circumstances, their hopes, their dreams, their challenges in life. And most of not all of these individuals come from very materially challenged circumstances. As I recall correctly, most make less than $40,000 or $30,000 per year. And we got significant data back from them on how to best inform and write and implement the guaranteed income pilot program. And I think subjectively, and in terms of the practical sense, benefit programs should be designed with an understanding of those challenging experiences and meeting people where they are. And I think that's the challenge that a lot of us who are more of this academic policy and quite frankly elite space have a challenge and have a significant challenge in doing. And that's what my colleagues and I hope to kind of break through as we move towards implementing this guaranteed income pilot program. And I would just like to agree in with the points that Signa Mary made, that goes back to institutional design, who's designing it, individuals who are adverse to any idea of the working poor and the circumstances that they lived through, back to the Reagan era, the notion of the welfare queen. So I think a lot of these forces are deeply ingratiated, and I think it's up to us to do our best to overcome them. And that's, I think, our best hope. So thank you.
Thanks. I wanted to read a comment, or part of a comment that was in the chat, and then ask a question related to that. So someone wrote, they're a research fellow at UPenn for the Bridge Project, a guaranteed income pilot in some of the most vulnerable families with children in New York City. Turton says, when I interview program recipients, they share serious concerns over losing benefits and terrible experiences at New York City social service agencies. And this, I wanted to ask a question, but also say, have a little bit of comment. Is this related, Tyler, I think, to something you had said and something Mary also alluded to, was that there's just overall, it's both the asset limits, but also just the confusion around what they are. And so I was wondering if you could both talk more about just that confusion and what impact the confusion might have, and then also answer this question, which relates to what is the role of safety net program administrators in addressing this?
You want to go first, Signa Mary?
Yeah, go ahead.
Oh, thank you. Yeah, absolutely. From my perspective, and again, I'm not a benefits program manager specifically, but the information about benefits programs is presented in such an ambiguous and obtuse and unidentifiable way to even access that information, right? And this is by populations that are away from the modern streams of discourse. Many don't have internet access. Many are, struggle with literacy issues. And I think it's fundamentally, part of that divide. And I think it kind of goes back to the human-centered design notion. I think it's up to jurisdictions to kind of meet people where they are and to abrogate that confusion in any sort of way that they can. And I'm no expert on how you do that specifically, but I think a lot of it has to do with how these programs are framed. And I mean, for example, when I was at the courthouse eviction efforts the other week, there's this huge chart on the eviction process that the Commonwealth of Virginia has. And as a fairly educated person myself, I had a hard time understanding it. So someone who doesn't have the same experience as I do, they're definitely not going to understand it. And how do we break through that? And I think that's a significant challenge. That's going to take a lot of more empirical kind of investigation and research to figure out. And I think a lot of it comes down to how these programs are framed and the fact that benefit programs are administered by local jurisdictions on behalf of the federal government. It's a question of where you look, and I might not be the best person to answer how we address these problems specifically, but I think identifying that broader issue of framing and making it a framing that is more trauma informed and more circumstantial to the conditions, material conditions of the individuals that we're working for and with. I think that would be a great first step to do that. And I'm sure there are jurisdictions like in New York City and throughout the entirety of the United States who are trying to do that the best they can.
Yeah, I'll just add that I'm excited to have the power of behavioral scientists behind this, because you said, what do caseworkers do? Most benefits recipients don't receive benefits from just one program, right? There might be health insurance, childcare, SNAP. And so when all the programs have different limits, Medicaid, then it is confusing, right? And very hard to figure out. So I think, spreading the word about these unintended consequences and trying to get them either eliminated or up high enough and the message clear enough that you don't have to close your bank account and you can have more than $500, I think is so important. And the COVID pandemic, I think, really reminded all of us that that anyone, we're all affected at different points in time. And so I think it's a time for us to look differently at this idea of the deserving poor and who our programs are serving.
Thank you. So Mary, you just alluded to something that was related to another question we wanted to ask. So during the pandemic, universally available benefits such as the stimulus payments and the expanded child tax credit, which you mentioned, were administered through the IRS and were directly deposited into people's bank accounts if they have them. And so people who didn't have bank accounts had to go through extra steps to receive these benefits. So this is just like one of the examples of the harms of being unbanked. So can you talk more about the challenges people face when they don't have a bank account? And you mentioned this a little bit in terms of how this relates to the asset limits.
Yeah, when you if you don't have a bank account, right, and then the stimulus payments, and it was something that, like, as a research field, there was a lot of talk for a while about not having a bank account, and then it kind of went quiet. And then when we were trying to get those relief or stimulus payments out, and we couldn't reach the people who needed them the most. I know the FDIC had a big campaign. It just became so evident again, the effects of not having a bank account. But it's gonna, make you more likely to turn to the alternative financial sector, where you could end up with higher cost loans, and less likely to get those direct deposits. It's expensive too for the government to mail cash checks. There was a prepaid pilot we did, evaluation that we did for Treasury, looking at when they had tried to use prepaid cards instead of bank accounts as another opportunity for people. And people found that a convenient way to get their taxes too, because otherwise you might be going to H&R Block or another place and paying part of your tax refund in order to get your refund to yourself.
Thank you. And Tyler, I have a question specifically for you, which was, how did you land on the $500 amount? Can you speak to decisioning around landing on the $500 amount for the pilot?
Absolutely. I think we took stock of other guaranteed income pilot programs throughout the United States, and on average, that is the benefit that they provide. And there were institutional factors in that decision, correct? So in terms of the design of the pilot, the city of Alexandria received $3 million from the American Rescue Plan Act that was passed last year. And so we had to take budgetary considerations into account. In addition to that, in an ideal world, we would provide a much larger benefit. But in terms of operational and bureaucratic considerations, in tandem with kind of in the aggregate, the other benefit program or the other guaranteed income pilot programs throughout the United States, we landed on $500 per month. It's not a perfect number. It's not normative by any standards. It should be much higher, in my opinion. But in terms of the constraints that my colleagues and I are facing and have faced, that was the most reasonable number that we could decide upon. And
Thanks, that was really helpful. And then Mary, a question that's a little more for you. So on our last webinar with the Policy Lab, we focused on how administrative burdens keep people from enrolling in or continuing to participate in safety net programs. So did you learn anything in your research about asset limits and administrative costs in your research? I think I saw churn mentioned in one of your reports.
Yes, that was another something else that we looked at. And what we found was that when states relax their asset limits through broad-based categorical eligibility, it makes the recertification process less burdensome, which makes it easier for households to stay on SNAP. And we found that it reduced SNAP churn, that churning on and off the program. When households face those SNAP asset limits, it can leave the household to leave the program when it's time to recertify their benefits, and then need to reapply for SNAP later. So that could be part of the difficulty with asset-related documentation at the time of recertification. And so this then lowers administrative costs because it's less costly to recertify people than it is to redo the entire application. And like the statistic we found was that being in a state with broad-based categorical eligibility, which relaxed asset limits, decrease the likelihood of churning off and on the program by 26%.
Thank you. We have a few more minutes, so I think we can do 2 more questions. We had another question come in. Someone asked that when they were an AmeriCorps member, they found out that their income wasn't supposed to be counted for food stamps. And that made a really big difference, and their income was 0 for getting food stamps. Is there something like that that could be implemented on the guaranteed income programs?
Absolutely. I think that would be a great place to start. The question is whether higher authorities are going to let that happen, right, at state social services agencies. For example, in obtaining a benefits waiver for our participants, lawyers at VGSS had to review it and to pull strings on their end. So I think that's a worthwhile goal, but it's going to be contingent upon how other institutions approach that question, and that might be in contradiction and be in contradiction with what such as a person myself at a guaranteed income pilot would want for beneficiaries in terms of counting their benefits.
Just to add, so this is a Twitter sidebar, so I should be a little careful, but with the proposed student loan debt forgiveness that's out, I saw Susan Dinarski, who's a professor and expert on student loan debt, saying if we just get rid of the income tests, which make it so much more complicated, and then the people with the lowest income who need it the most are going to be the least able to provide all that documentation and meet all that. And so you are really eliminating the people who need it the most.
And then I think one last question, we'll see what the time is like, but can you speak to kind of the opportunities for change, or what you think the national climate is, both on kind of eliminating these resource limits or moving towards some kind of universal income for families with low incomes? I would also throw into that question a lot at you. When you're thinking about change on kind of the asset limit programs, on having asset limits, do you see that as being primarily a state issue, a federal issue, some combination of both? Like, where do you think we can actually have action on this?
Yeah, so I guess I think there's sometimes we're working in silos, right? And policymakers are working in silos too. These programs are administered out of different offices. What I've heard sometimes in the past is that there has to just be some limit. So this idea of this millionaire or the super high, person, just like that possibility couldn't exist. So if that's the case, then I would just say, make it consistent and make it really high. I think often in federal government, they look to states as successful laboratories. Where have we seen successful things in states? So I look at baby bonds as this potentially bold solution right now to reduce wealth inequities. And I think the states need to do it first. So the fact that California, DC, and others, and I'll just add that, guaranteed income programs you mentioned, we need both income and wealth building programs for economic security. The income is going to meet the basic needs, and then the wealth is going to be the resilience and that springboard for opportunity. And I'll make a plug. We have an event at Urban Institute on August 3rd, which is about baby bonds and how it fits into a suite of income and wealth-based policies. And we just put a blog out on it yesterday because we absolutely need both. And I'll just throw in a concluding statement because I know we're about short on time, and that is that we can make structural changes that build wealth and close wealth gaps, and that it's really exciting to have behavioral scientists behind lifting or eliminating these resource limits and reducing wealth inequities, because I think you have a really big role to play. And we have evidence that you can cite.
Yeah, my personal perspective on, thank you, Signa Mary, that's a great segue. I think, yes, states will be the laboratories of this experiment, and more liberally inclined states think there's a better chance for these things to happen successfully, right? I don't think that's, and obviously it's not uniform, but might be a harder lift to implement a guaranteed income pilot program, even in more conservative states because of the politics. Yeah, I'm pretty biased against federal authorities in terms of systems change, because they've demonstrated time and time again that they're hesitant or resistant to anything about that. So I think that's a constraint. But the hope is going forward that maybe there will be political change where more and more constituencies throughout the United States will be in favor of guaranteed income pilot programs, and hopefully that will be able to be implemented on a more broader scale. But the political dynamics at the federal level, I think, have to change significantly for that to happen. So.
Well, thank you both. We are at time. I really appreciate this wonderful conversation and you taking the time to speak with us. We will follow up with everyone who has registered for the webinar will get a link to it, and we can also add some additional materials. I know there were questions we did not get to, and so we can include some links to some materials that might help answer those questions. I just wanted to flag that we are in the process of planning for our fall slate of events. Many of those are going to build on things that we've talked about today. So expect to see coming up an event that focuses on implementing basic income programs, and an event on policies to increase emergency savings for people with low incomes. You know, all of these things are really interrelated and focused on promoting economic security and ending chronic scarcity, which is what our event series is really trying to help innovate around. So if you have ideas for a topic or just general questions, email us at thepolicylab@ideas42.org, and we will see you in the fall. And finally, I just want to say another thank you all for coming to this event, and to Wells Fargo for making this event series possible. Thank you.